A 43-year female presents with complaint of pain in the lower abdomen area or in the pelvis with painful micturition and urgency. She cannot hold her urine for a long time. Here we see a well-defined heterogeneous mass. The mass shows hypoechoic and central hyperechoic areas with complex structure. The mass is not much solid as we see the whole structure of the mass. The margin of mass are smooth and also we see posterior acoustic enhancement. Now on color Doppler we see internal flow present. Here we see increased blood flow at this part of the mass. Here we also see a calcified echogenic area with shadow. Here we see the urinary bladder. The mass lies adjacent to the urinary bladder. Now we scanning the uterus or searching the uterus, but we cannot clearly visualize the uterus here. Here we see the mass lies anterior to the uterine wall, which compass the uterus or completely cover the uterine wall. Due to this large mass, the uterine walls are not appreciated clearly. Here we see the endometrium as thin line. Now we will measure the endometrium. The endometrium is appear as a thin line, which is normal. The size of endometrium is 3.9 millimeter, which is normal. The normal size of endometrium is up to 12 millimeter. Now we will measure the size and volume of uterus. For volume we need three dimensions, a transverse and oblique view. Now we measuring the width of the mass. Now we will measure the length of the mass and then depth of the mass. The size of mass is 100 into 96 into 8 millimeter and volume is 455 milliliter. Here we also see the left adnexa or left ovary. Now we will measure the size of ovary. The ovary is normal in size or shape and shows normal texture. The size of ovary is 31 into 18 millimeter, which is normal. The mass is lies in the myometrium in the anterior uterine wall. Now how we will write report. Uterus is anteverted and a large well-defined heterogeneous mass size 100 into 98 into 88 millimeter having volume 455 milliliter arises from the anterior wall of the body of uterus. On color Doppler internal flow also present. Endometrium is normal in size 3.9 millimeter. Left ovary is visualized and oval shape and also normal in size. No cyst mass present. Right ovary is not visualized, maybe due to large mass. The urinary bladder is partially filled and compressed by large mass. The ultrasound diagnosis is subserosal fibroid and the patient is referred to gynecologist for removal of this fibroid